This morning I've presented the results of the monarchE trial. Actually, in that study, what we were looking for was to look at the patients who were carrying germline BRCA1 or BRCA2 mutations. And also, the second part was really to look at the less common somatic alterations which were occurring in that trial. So just to frame again the trial, so the monarchE trial is an adjuvant trial which was comparing Abemaciclib plus endocrine therapy for 2 years to endocrine therapy alone. In this study, we did an analysis in a subset of the full cohort to really look at the germline BRCA1 and 2 and the uncommon somatic mutations. So here we showed that the germline BRCA1 and 2 mutations were present in 3.5% of the population. And importantly, we've shown that most probably there will be a benefit of Abemaciclib in patients having these germline alterations. And this is important because previous data in the metastatic setting have suggested that patients with these alterations would not benefit from CDK4/6 inhibition. The second part of the results, there we were looking at uncommon somatic alterations, which were defined as alterations having a frequency between 3 and 9%. There we identify mutations in different genes, including, for example, mutations in cyclin E2, in also NF1, RB1, or BRCA2. So there also we compare the frequency of these mutations with what was already previously reported in the Cancer Genome Atlas. And we saw that in the monarchE trial, globally, most frequencies were similar, but there was a higher proportion of mutations in RB1, NF1, and BRCA2. When we look at the survival analysis for these uncommon somatic alterations, we found that in most of the genomic groups, the benefit was preserved for Abemaciclib, but that it was not necessarily the case for patients having RB1 or BRCA2 somatic alterations. So I think that these results are very important, especially those with the germline BRCA1 and 2 alterations. However, we need to be extremely cautious when interpreting these results, given the small number of patients, given the fact that also it's not on the final outcome data, and that these results obviously need to be further validated.